Well, time now for a Q&A, and as you know, we ask people to send in their questions. Some now may be a little bit out of date, but I really have tried to get as many in as possible because so many people have contacted me, rung me, emailed me, and thank you for everyone for doing that. And we have the Minister for Health, Social Care, David Ashford, giving up his Sunday. So thanks for that as well, Mr Ashford. Here we go then, and I'll do this without my glasses, I think. Well, I may have to go to minutes. But while answering a question early in the question session and while trying to defend the steam packet, Mr Quayle alluded to the fact that the outbreak could have been started by someone in a 21-day quarantine, not sticking to the rules. My question is, how many visits would be made to someone in quarantine by the Cabinet Office or a representative during those 21 days to ensure the rules are being adhered to? Would they visit only during office hours, and are phone calls checks made by landline to the registered quarantine address?
So yes, checks are made on those who are in quarantine. It varies from phone calls to physical visits, and it's not just during office hours, it is outside of office hours as well. I think speculation, it's important we avoid. We can't say for certain that it's linked to the steam packet cluster, but equally we can't turn around with certainty and say that it's not the current outbreak that we're seeing. So I think it's important that we don't speculate too much on that. What's clear is we don't know the source of the current outbreak. So we can't say that it was a case of it is linked to the steam packet, and equally we can't say it's not.
One that will come up every week, I'm sure, it's still about the masks. About a quarter of the people this person has seen was wearing masks. Considering the figures, I feel masks are strongly there to protect us all. And if the government strongly recommended us to wear masks, more people would. I've seen people working in vans, working without masks, working on the roads near each other, not wearing masks.
We do strongly recommend the use of masks, and we would urge people when they're out in public to wear them. There are medical reasons why certain people won't be able to wear masks, but anyone who can, we most certainly do strongly recommend. It's not something we would try and do legally, because as we've seen in other jurisdictions around the world, it's nigh on impossible to legally enforce. Legal enforcement of it just doesn't work. So it's not something we would go down the route of trying to make it a criminal offence. But basically we do urge very, very strongly that people out in public, if they can, do wear a mask. But we do have to remember that there's certain people, like I say, with medical conditions, underlying conditions that don't mean that means they can't wear a mask, and we have to respect those people as well.
And I think we talked about this before. You can get some sort of little ID thing, like is it daffodil or something that people can put on?
The sunflower lanyard, that shows a hidden disability. They are available, and I know shops, etc., which do normally mandate masks, have been taking a very sensible approach. Our retailers have been very sensible about it and understanding of people who've got medical conditions.
Please ask why public toilets across the island are closed to key workers, including delivery drivers.
Public toilets carry a risk. Many of the public toilets are operated by local authorities. There's people who have to clean them, maintain them, and there is a risk of transmission from public toilets. So the decision has been made for most public toilets and conveniences to be closed.
What's the alternative? Seriously, I mean, if someone gets caught short, I mean, they're going to commit an offence going behind a hedge, aren't they, or something like that?
Yeah. So not all toilets are shut. There are some, I believe, that are still operational. But we do have to be careful about the spread of risk. And so it is a problem, particularly for people who are out on the road all day. But in terms of deliveries and so on, that should be massively scaled back anyway. So obviously the post office is still operating and the parcel delivery services. But generally, most of what we would term delivery services would actually be closed under the current outbreak.
Clarity on shielding. My partner has a shield and I am in construction. I'm told to work on. I phoned 111. Oh, of course, that's now changed, of course. But I phoned 111 and the community helpline who I spoke to said legally they can't give me an answer. So this bit may still be relevant. If one in household has to shield, do the rest of the household also have to continue? So that could be someone working in manufacturing, I suppose.
Yeah, so it depends upon the person whose shielding's condition. It is recommended that where possible, a household would shield with them. If that's not possible because of work and so on, we try to recommend that they try to have as little interaction with the shielder as possible. It's not a legal requirement, shielding. I need to make that absolutely clear. It's a medical recommendation, the same as anything else.
Why are our borders not being raised to level 5B as in the last lockdown? Surely it's now imperative to keep a further threat at bay. At the moment, we're at level 4, which is where we were prior to the last 2 lockdowns.
Yeah, so the situation has changed in relation to the borders in the fact we now have the 3-point testing in place. We also have we also have 21 days of people isolating if they do not wish to take the tests. So actually, we don't really gain anything by moving up that scale anymore. With our increased testing capacity and the fact that people either have to be tested or do the 21 days, there isn't much actually gained by moving up any more levels.
Why are you refusing to vaccinate the police? My daughter's in the force, and yesterday they had many people in isolation, including the whole of one department. I won't say which. I can only imagine it will be much higher with the school closures. Surely we must be near the point where it will be, if there's a major incident, emergency services would not be able to cope.
Well, the first thing we need to focus on with the vaccine is the vaccine does not stop someone contracting COVID-19. It only prevents that person from becoming seriously ill with it.
Doesn't it reduce it though, Minister? It does reduce it.
It reduces it, right, hang on, I'm coming on to that.
Okay.
So it doesn't stop someone contracting it. It doesn't stop them passing it on to someone else, but it reduces transmission potentially. Scientific studies have been very encouraging that shows that it reduces transmission somewhere between 67 and 78%, but it does not stop transmission. And that's very keen to point out. So someone who has a vaccine can still contract COVID and still can pass it on. So that wouldn't help with resilience of the police or any other. So it doesn't help with the resilience in health either, because if a police officer is vaccinated and catches COVID, they've still got to isolate exactly the same as anyone else. So it doesn't help around resilience. The focus of the vaccine programme isn't based on someone's likelihood of getting COVID. It's based on the outcome if they get it, so serious illness and death. And that's why the vaccines have to be prioritised for those that are most at risk and most likely to actually suffer serious harm. So it's important, for instance, that cancer sufferers, for those in the vulnerable category, that they get the vaccine first. If we start moving around different groups, particularly groups that if they do actually catch COVID are likely to remain perfectly healthy, then that means it takes longer to get those vulnerable categories done. And that's why the correct approach, which is what we are following, is to vaccinate by age and vulnerability.
And the UK's on the telly today saying they're down to the 50 pluses now. We're still seems to be still a bit further up that
right, we need to clarify this because this is invites. When the UK talks about vaccination, they are talking about people receiving an invitation letter, not people actually physically being vaccinated. So we could invite the entire population tomorrow, but it doesn't mean anyone will get vaccinated any quicker because we can only vaccinate to supply. When we speak about vaccination, whenever people hear me talk about it, I'm talking about people physically having been vaccinated, not just invited. And I think that's a much more transparent way of doing it. For instance, I've got a friend in the UK who has actually been offered their vaccine, but their appointment is in 5 weeks' time.
If the testing capacity is 800 a day, why are people waiting 3 or 4 days for a test?
Right, in relation to the testing capacity, people have got to get booked in. There's also the issue around the high-risk contacts as well. So it's not just a small number of people being tested, it's a large number of people. And 111 has, let's be frank, been a bit overwhelmed trying to get people booked in. But our testing capacity is there and it is getting used.
How many households have confirmed cases of COVID in the lockdown compared to the first? They now appear to be testing whole households rather than just one person. Is this inflating the comparative figure and raising fears within the public?
Well, the first thing I say is the figures aren't comparative between the two lockdowns, and we shouldn't be comparing because things have moved on massively in the last 12 months. So our testing capacity is massive. Now the person is quite right. We are testing wider and with more households. So it's not correct to start looking at comparative figures. People might remember, for instance, the antibody study that we did, where we were doing as a population study that found there was potentially maybe 1,000 cases across the island that had occurred, whereas our actual figure we knew of was 300. So in the first outbreak, it was around the 300 mark. So we need to be a bit careful around trying to compare the first lockdown and testing figures and outcomes compared to this one, because a lot has changed in 12 months.
This one's from an intensive care nurse saying luckily she was off on Friday but concerned as to what will happen next week. So obviously this has come in a few days ago. My parents had been over helping during the last lockdown but had to return to the UK as declined a COVID vaccination here despite owning property and previously working here. The recent decision leaves me unable to work as an intensive care nurse. I know for a fact the unit is very busy and very understaffed due to staff already shielding and isolating. I'm also not sure I'm not the only staff member at Nobles that will no longer be able to work as I have no childcare provision put in place. I am also concerned as to how I'll pay my rent, bills, buy food, etc. I'm unable to work. I already struggle as a single parent and not entitled to EPA due to the hours I work and the lock on the lack of registered childminder that would cover them. My stress levels are high at the moment, and that's without the added stress of caring for patients with COVID. The constant worry of what I will do with my child so I can work is now having a massive impact on my own mental well-being.
So in relation to education, I'm hopeful the Minister for Education, Sport and Culture will be able to make announcements in the next day or so around what we're going to do for childcare for absolutely essential key workers such as those in health, such as police officers, and how we'll be able to try and fix that problem. Shutting the schools was an absolute last resort. That is not something we wanted to have to go down the route of, but when it became absolutely clear that the transmission was being generated by schools, we had to introduce a temporary fire break in order to stop that route of transmission, and hopefully that will be a very temporary measure. It is stressful, it's exceptionally stressful for single parents at the best of times without having this added stress on top. But like I say, I'm hopeful the Minister for Education, Sport and Culture will be able to make announcements around this, if not later today, then certainly tomorrow, which will help alleviate some of the pressure. In terms of staffing up at Nobles, I've not tried to hide the fact we are under pressure, as with all services, because of the number of people who are in self-isolation. But that was the announcements that I made the other day around some things we are stopping doing so that we can build staff resilience, focus on what's important with COVID, which is the side wards, such as Ward 19 that we've brought back into activation, and obviously ICU as well, to ensure that is appropriately staffed for those patients who may be in a serious condition.
One more in this section. Can you ask about the vaccine rollout for the clinically extremely vulnerable? We're in the priority 4 group, along with the 70s and 75-year-olds. I've still not received my vaccination letter. Whenever I ring primary care, I just get put onto an answer phone.
Right, in relation to the extremely clinically vulnerable, those lists are generated by the GPs. So it's the GPs themselves who give us the list of their patients that they believe are in that category. There has been confusion amongst people as to whether they are extremely clinically vulnerable or purely clinically vulnerable. There is a difference. And I know there's been some arguments with people thinking they're in the extremely clinically vulnerable category when they're not. They're actually in the clinically vulnerable. The clinically vulnerable letters will start going out from next week. So people will be starting to receive letters who are in that category as well. But it is the GP that needs to have the assessment and say which category people fall into. Some people have been reading their conditions and saying, I'm a group 4, when they're not, they're actually group 6. But the group 6 letters will be starting to go out from next week.
Okay, we have more in the next section.